Good day. We are from Block P 8231 and we will be presenting about the assisted suicide. The topic that we have chosen is the case of Elizabeth Bovia. Bovia versus Superior Court in 1986. In 1983, Elizabeth, at the age of 26, was almost totally paralyzed by cerebral palsy and had severe degenerative arthritis, which caused her great pain. She requested hospital authorities to allow her to starve to death. But after Elizabeth had announced her intention to starve herself to death, the doctors had her force-fed against her will by inserting a nasogastric tube into her nose and started pumping liquids into her stomach. Elizabeth was mentally competent and understood the risks. She was neither comatose nor terminally ill. The court ordered enforcement of a patient's exclusive right to refuse any medical treatment or service, even life-saving or life-prolonging. Her doctors were directed to remove the tube and were prohibited from replacing it without her consent. In the court's opinion, Elizabeth's decision is a moral and philosophical decision for her alone to make, not a medical or legal one, and no liability would result from honoring such a decision by a competent and informed patient. With forced feeding, Elizabeth had a life expectancy of 15 to 20 years. Removing the tube would not have been suicide. Instead of causing her death, its removal would have hastened death, because her health had declined to a point where she was no longer able to get sufficient nutrients orally.
Through the case of Elizabeth Bovia, an ethical question that comes in our mind is, does a person who is severe, disabled, or terminally ill have the right to choose how and when to end their life? This is an ethical question because this is between choosing life and death, or it is an immoral or immoral thing to do. It is argued that we have a responsibility to reduce the suffering and preserve the integrity of our loved ones. Lying in our hospital today are people afflicted with excruciatingly painful and terminal conditions, and diseases that have left them permanently incapable of functioning in any dignified human fashion. They can only look forward to greater hardships, degradation, and deterioration in their life. It is cruel and inhuman to ignore such people's appeal for a merciful end to their pain and degradation. Compassion requires our compliance and cooperation.
What are the facts about the ethical question? There are many patients suffering from different illnesses, and it puts them under a lot of pressure. Especially when a patient is in the last stage of their life, that the ethical question about a living will pop into their minds. Today's medical technology has accomplished incredible feats in extending human life. Respirators can help a patient's failing lungs, while drugs can keep their physiological processes going. Medical technology is science's greatest gift to humanity for those people who have a reasonable possibility of surviving an illness or accident. It is, however, merely a technique of prolonging misery for the terminally ill. Medicine is supposed to relieve a patient's pain and suffering. But all modern technology accomplishes for a dying patient is to increase their torment and agony day after day. In the past, some terminal patients have gone to doctors and requested a final treatment that would relieve all of their pain: lethal pills. Many terminal people demand the right to assisted suicide since it allows them to live out their lives without the pain and expense of dying. Most people also believe that the right to assisted suicide is a natural one that does not need to be granted. It is a liberty that cannot be denied, since those dying may wish to exercise it to find happiness.
Who or what could be affected? The bereaved family and friends of patients who died by assisted suicide cope better with respect to grief symptoms and post-traumatic stress reaction than the bereaved of comparable patients who died a natural death. The physician plays a crucial role in assisted suicide. The emotional and psychological impact on the physician who participates might be significant. Many participating physicians may be affected by the shift away from the medicine's primary values of healing and promoting human wholeness. Doctors describe being profoundly impacted including being stunned by the patient's unexpected death, being involved in the patient's request for assisted suicide, feeling powerless, and feeling isolated. Some patients have illegally put pressure on the force doctors to help them commit suicide. Counter-transference in the doctor-patient interaction may have an impact on physician participation in assisted suicide.
Decision. We agree with the decision of terminally ill or severely disabled individuals to have the freedom to choose what and when they want to die. The concept that doctors should only be healers places too much emphasis on the doctor and not enough on the patient. When treatment is no longer possible, when death is near, and she finds suffering unbearable, the physician's responsibility should shift from healing to reducing pain in accordance with her wishes, as in the case of Elizabeth Bovia. Nevertheless, no physician should be forced to comply with the request to help a terminally ill patient die, and no patient should be forced to make such a request. Both the patient and the physician must make a rational decision. The right of a competent, terminally ill individual like Elizabeth to avoid severe agony and accept a timely and dignified death has historical basis and is implied in the concept of ordered liberty. This right, like those protected by this court's rulings on marriage, family relationships, procreation, contraception, child raising, and the refusal or rejection of life-saving medical treatment, is essential to personal autonomy and bodily integrity.